Welcome to this week's episode of Making the Shift from RN to NP. I'm Katie Voglar, Nurse Practitioner. In this limited podcast series, we'll explore what it's really like to make the transition from RN to NP. At Hippo Education, we work on real-world, practice-changing guidance to help you become the best NP you can be. For being a listener, we'd love to share with you our free NP clinical resource guide, which you can download at hippoed.com/makingtheshift. Now let's get started. Deciding where to work after nurse practitioner school can be challenging. You have to weigh a never-ending list of variables, including compensation, your benefits, schedule, the support you'll receive on the job, the onboarding process, and you're going to have to weigh how all of these things will impact you and your family if you have one. This is not something that's being taught in nurse practitioner school, and so often we're left to process these things on our own. But that's why we're here to help. My guest, Jack Thurman, is an adult gero acute care nurse practitioner who navigated this decision-making process over the last few years and has learned some really valuable lessons. I'm so excited for you to hear from his story. Jack, welcome to the podcast.
Hey, Katie, thanks. Glad to be here. This is fun.
So excited to have you. So, your first job out of nurse practitioner school, you were an NP on a trauma service. Walk me through the decision on how to take that first job. What variables were you weighing when you were deciding if this was the best job for you?
Trauma's very exciting. And I, as a nurse, I worked on medical, surgical trauma, ICU units. And that kind of provided a lot of my foundation and background. And so obviously kind of going into NP school and thinking through, what am I going to do when I finish? That was natural for me. And everyone's different. Me personally, I kind of have that, you'll find a dry, kind of blunt type of humor with a lot of trauma people. They'll shoot you straight. They'll kind of we don't have a lot of time to make it pretty. And so they're straightforward individuals, which we can get into later. But I mean, that also goes hand in hand with a lot of the physicians are straightforward, sometimes, not in a pleasant way. Trauma's fun. You spend time in the OR, and so you get some reps there. And that was a brand new, very exciting world for me to be a part of. And then I think another aspect of it that I really enjoyed was, so my unit was trauma general surgery. And so there was also a component of working closely with all other service lines in the hospital, and them encountering a patient or a situation they weren't familiar with, and leaning or asking us about it. And so all of that are things that I got a taste of and led me to pursue trauma. More specifically, and I wanted to be sure I share this with you and our listeners, but there were 5 main things that I thought about with this job or with any job that I took. So it's pay, the specialty, the commute that you make, 4th, the benefits and the time off you'll get, and then 5th is the environment. The people and the people you're reporting to. So those are 5 things. And you can probably get, especially as a new grad, you probably get 1 or 2 or 3 of those. You'll be a more experienced provider before you can lock in all 5. So I would recommend sit down and ask yourself, of those 5 things, what do I value the most? And that can help guide decision making.
What would you say was the thing that you valued the most in that first job decision-making process, the thing that weighed on you the heaviest?
Yeah. So you're new. You're not going to get tremendous pay. Commute didn't, for me personally, wasn't a huge issue. I know benefits are important, and I think that matters more when you get into a family life. I valued the specialty. That was probably the one thing that I chased harder than anything else. Was I was looking at trauma positions or ICU positions. Those were just worlds that I had experience and success. I knew the people. I knew the sights and sounds and smell and how it works and what it feels like to be there. So for me, that meant, as easy as it can be, a transition from a nurse, from a student, into real world and acting as a provider. So I chased that specialty.
That makes so much sense given your history. Sounds like your personality. You are a little bit dry, and you
Thanks.
liked trauma. That was your experience as a nurse. You liked trauma.
Right.
But with trauma, I worked in the ER, so worked with a lot of trauma physicians and APPs. That schedule can be hard because you don't give up your 12-hour days or your nights, weekends, like most of us do coming out of NP school to work in a clinic job. You're still with that schedule. So how did that schedule work for you? And I know you have a family, but how did that schedule work for y'all?
It was really tough. I landed with a level. It was technically a level 3. We were in pursuit of a level 2 trauma center. So that was a change from the level 1s where I had worked as a nurse and where most of my clinicals were done at. Because of that, it's a smaller hospital, smaller facility. There's less providers, so it was really just me and one other NP as the mid-levels for the trauma service, and she was far more senior. And so what worked best for her was a 7-day on, 7-day off rotation. And that's what I signed up for. And that was really difficult. Obviously for her, it was what she wanted, but when it's just you and someone else, it's hard to find someone to cover a shift for you to go on vacation or take a break. But I was married and we were having little kids. And so those 7 days on, I mean, these are 12-hour shifts. And I say that, and I hope everyone listening knows it's not a 12-hour shift. It's at least a 13 or 14 or 15-hour shift, and especially that when you're new. And so these are 15-hour shifts, 7 days in a row, and peeling me away from family, and so that was really difficult, but also better in some ways, and that's important to weigh out. Smaller facilities, I got more reps in the OR than I would have if I was at a level 1 facility, and I got more chances to practice procedures than I otherwise. I'm not competing with residents like that.
Yeah, there's a lot of benefits to being in a smaller shop, but then you mentioned, especially depending on your personality, your schedule, working 7 days straight. And you're right, it is more of a 13, 14, 15-hour shift can be really, really hard. How did that end up for you and your family?
It was hard, Katie. I had a son, and then we had a little baby, and the baby got sick. They didn't diagnose failure to thrive, but he was not gaining weight. He did need to be in the hospital and on fluids, and I was doing these shifts, so it got really hard. Really, and this was around a year into me doing this job that all of this hit, and so a really hard conversation with my wife, and just like, we can't keep doing this. The 7 in a row. I mean, I'm totally absent from helping her, and I'm absent even as a father. Just I wanted to be around my boys more, so we had to make the decision for me to step back from healthcare in a full-time role at that point. That's how it ended up for me.
Well, I'm sorry to hear about your son. I know he's doing better, and so that's good. But there's some things that we cannot expect. We cannot anticipate in our first jobs. We have no idea if family needs are going to change. And so this might be a hard question, but looking back in that first job and knowing now what you know about what your family was going to have to go through, was there anything that you would have done differently in that decision-making process of, is this the right role for me as a new grad straight out of school working 7 on, 7 off in a trauma service?
Yeah, I think that's a great question, and there's probably a couple best ways to answer it. One, I guess if I was talking to myself back then, to be in the position, if trauma was just it, and I had to figure out a way to make that work. There are clear things like communication. I could have communicated with my wife and even kids better on what those expectations would look like. And you have to do a good job of managing sleep and your time off and de-stress from the job. But I think truthfully, if I could speak to myself before I accepted that job, my advice would be take a good hard look at situations where they're asking you to do 7 on, 7 off, and even to forecast where are you going in life and what are you wanting that, because it's just such a high demand. And so if these listeners are family oriented and family driven, give a second thought about trauma. Now, it's not always the case. Larger facilities will have more providers, and those exist, and you could get 2 or 3 in a row and then be off for 2 or 3 days. But I think the other chunk, and probably a big thing that I wish I knew was, hey, family is going to be important. And so while trauma is fun, let's be open-minded, and let's just think about other specialties that would go hand in hand well with your personal goals in life.
It's really, really good insight, Jack, into sort of looking back and where you were. It's really hard to try to balance a career and your job, your dreams, your goals with things that are sometimes outside of those and competing, like family or even just mental health. I can think of situations where someone might not choose to take a certain job just to give themselves more time off, just to do this thing that you said, like relax and de-stress.
I talked to a bunch of people, and I spoke with, and just I'm thinking more through this trauma that I was a part of. It almost is kind of a single person's game. So I think that's just another piece of advice for listeners. If you're interested in trauma, just know that it's got those high demands. It really is a great, fun, exciting field. But most people that exist in it that I encountered, either kids were grown or a spouse also worked, and that gave them an ability to just give themselves to this really cool specialty. So I wanted to make sure I shared that, before I feel like we're just ripping on trauma over here, and it's part of my past.
No, I think that this translates into so many different areas, though, Jack. And just considering, how is this job that I am looking at, how is that going to translate and impact my family and the other things that are going on in my life? I do want to talk a little bit about your transition from your role as a nurse in trauma to then being a nurse practitioner on a trauma unit in that first job. How did that transition go from being an RN to an NP in the same kind of field? And what did you do to make that transition easier as a new grad?
Yeah. That's great. So one thing that I valued and still do is mentorship. I think that with anything in life, there are people who have gone before you, who some have done it well and some have not, but we can learn from all of these people. And so I had 3 individuals. One was an NP, 2 others were PAs. As NPs, let's not forget PAs are in a very similar world as us, and let's not fight. Let's be friends with everyone. And so there were other PAs that I could and did reach out to and learn about being an APP and how to do that well. And so it looked like coffees or lunches with them and regularly and updating them on how my job is going and what they did to learn from them and on how to do it better. Often the advice I would get, and I took their advice, was and this is where the 12-hour shift becomes a 15-hour shift. You get there early and you stay late. And so I'm looking up the patients that are on our list, and even as a new grad NP, just researching pathologies or, oh my gosh, reading notes. Like probably that was the thing that I could learn from the most, is just reading other consulted notes and seeing how these other physicians or APPs are thinking on these complex patients. that we have. And you're doing that on the front and back end of your shift. Another piece of advice I got was connecting with other APPs in the facility. So I was on the trauma line, and we worked closely with the ED, with the ortho team, with the neurosurgery team. So I became on first name basis, had their personal number in my phone and could text them with all of the APPs on those lines and the radiology department. I mean, so sit down, and probably within 2 or 3 weeks of a job, you'll see where you're spending a lot of time. Find the APPs that exist there, get their numbers, and be friends, and reach out to them. Things like that are going to help you transition. A lot of times they had just been around longer than me, and they could help me understand my supervising physicians, or even just how this hospital runs its trauma service. And those are huge things, huge conversations in it of itself, is for you to learn your supervising physician and your specific facility and how they do things. But those buddies, those connections that I made were really helpful with that.
Did those mentors that you had in your life, did they help you to process sort of the tension that you were feeling between being at work and then also feeling pulled to be at with your family and your family needs? Were those mentors also helpful, not just in your day-to-day job, but also sort of the outside of job questions that you had of, is this still the right job for me to be in?
Yeah, they were. And in multiple ways, but honestly, they were people who were maybe 10 years my senior and just a step ahead of me in life. So I had younger kids and they had older kids, and plenty of experience as a provider. And so I could sit back and just observe and hear about their own work that they did. One was on the cardiology line, and the other girl was on the trauma line, and so could see the differences, I think, just by observing them and how they made that balance. Mm-hmm. And it was through really that cardiology mentor that I saw. It opened up my eyes just to, wow, like there's a service line that's not 15 hours shift long, and like this guy's able to go to a baseball game with his kid, or take someone out to lunch, and that seemed good and something that I desired. And so I was able to ask him, like, how do we do this? And how does that exist? The unfortunate answer is, on trauma, that's not really a possibility, but healthcare and medicine is not just trauma. There's a lot more to it.
You're right. Thankfully, it's not just trauma.
Yeah.
I love that you really surrounded yourself with people that you could be honest with and ask questions. And I'm assuming, like all or most new grads, you battled imposter syndrome, that feeling of, I'm not enough, I don't know what I'm doing, how did this university give me a diploma? Are you sure that I'm able to take care of these patients? Were there certain situations in your first job where that imposter syndrome feeling surfaced, and how did you battle it when it came up?
Yeah, absolutely. I think you're crazy if you're given a diploma and you're just like, I got this, I'm good, I'm ready. Like there's something wrong, because at least in medicine, maybe in other fields not so much, but medicine's too much, man. That's too much. That's just too much for any new grad to step out and know. And so lesson one, don't be arrogant, don't think you know it all. Take the diploma and with humility, go into a new position, make friends, ask for help, learn how to ask for help. Imposter syndrome. I think with me, that was probably so we had a trauma clinic that was every Wednesday, and the surgeon it's clinic. Not everyone loves clinic, and I'm working with surgeons. These guys want to be in the OR. So they're in the OR. He conveniently would schedule himself to be in the OR on Wednesdays, and the clinic was kind of left to me. So I'm a new grad, seeing post-trauma, post-gen surge patients in a clinic setting, and honestly felt blindly trying to manage these patients and give them answers. Another area that I experienced it was with the consulting service lines. Like I kind of mentioned earlier, they're reaching out to me, asking, look at these images or patients presenting like this, and is this a surgical problem that y'all need to be working on? And then the last area that I experienced it was in the ICU, which is so weird to say. I was an ICU nurse for 6 years, but it's it's so different from a nurse to the provider. Everyone's looking at you, and you're making decisions. These are sick patients, and so okay. So how did I manage that? With the clinic, you go slow and you read and learn. Okay, so side note, go into something that you're passionate about, that you're happy to sit and read about, because that's medicine, and it's a continual learning process. And if you're in liver transplant practice lines and you get bored reading hepatology books, it's like this probably won't be great for you. And so read a lot, and that helped me in this clinic setting. I tried to make an effort. These patients are asking questions and I don't really know the answer. So I tried to make an effort to not say, well, let me ask the doc to get an answer for that, versus, okay, like I hear what's going on. We can discharge you out of the clinic, and I can follow up with you another time. And I'm going to go talk to our pharmacist or our lab tech. I'll talk to PT or these other PT, OT, these other service lines, and try to create and get a good answer by doing the work myself, versus using the physician as a crutch. He's there and he'll know the answer. I don't learn if I just ask him, well, patient presents, tell me what you want to do and I'll do it. So that's one way to battle it. With the service lines, I would refer earlier to, I knew the APPs on those other service lines. And so that made this imposter syndrome a little bit better. I could reach out to them and not feel so much of an imposter, right? Because these are, I guess for me personally, the APPs were people I could relate to. They were like me, versus the doc, who's a lot of people are putting up on pedestals. And the last thing was in that ICU setting. If you find yourself there, ICU nurses are smart and they're great, and they're friendly sometimes. So again, it's all networking, right? It's a hospital, and that's all I'm familiar with, but it's a very large network of people, and find the ones in any specialty who are happy to teach and not offended that you're asking the 50th question of the day, and lean into those individuals.
I know it's really wise advice. I love that most of your experience has been centered around knowing other people and being known, and that there is a lot of benefit in making connections, whether it's with other APPs, physicians, pharmacists, PT, ancillary staff. Like, I think that's really great. I really appreciate you sharing honestly with us, Jack, about your experience. To wrap up, will you share your best piece of advice for NPs who are in that decision-making process right now of which job to take right out of school? What would your advice be?
Yeah, I've got multiple best pieces of advice for you, Katie. I think my biggest one is like, there's a lot of value in shadowing. So if you find something you want to do, like, try to see if you can get a clinical rotation there and learn it. But if you're talking, to a cardiology group about a position, ask the doc or the APP if you can come in and shadow them for a handful of days, and hopefully the APP, that's the job you're going to do. So shadow those guys and see exactly what it is that their day and their patient load and their busyness looks like. Another piece of advice is, as you're a nurse or you're going through school, you're building your network. If it's ENT that you're interested in, tap that network, find a friend who's doing it, and take them to lunch and sit. And again, ask them, medicine's so big and these specialties are so big, it's impossible for you to know it. And so if you can find some way, be creative to get with people, to gain insight into that role, it works out really well. One last thing that I'll share with you, one more piece of advice. My church has an urgent care clinic where I volunteered as a nurse, and I still work taking shifts there on the PRN level. So my other piece of advice is to find a place to volunteer. You're giving back to the community. That's typically going to be a piece of medicine and healthcare. Like, that's why we got into it, right? To help people. I'm not doing it to make a paycheck. I'm doing it because I love it and I just want to help people. But again, and it has been like this for me, has been a deep, rich network. That's how I met Katie, and know Katie. Know you, Katie, was through that. And so it's, time volunteering is time very well spent.
Well, you know me, you know I love that answer. Jack,
Yeah.
I really, really appreciate taking the time to talk with you today and for you to share your experience. Thanks so much for being on the podcast today.
Terrific. All right.
Thanks for listening to this episode of Making the Shift from RN to NP. Be sure to head to hippoed.com/makingtheshift to get your free NP clinical resource guide. Visit hippoed.com/NP to explore even more education from Hippo to make your transition from RN to NP as smooth as possible.